Hi, Teresa Nutt here. Want to give you a quick overview of common pulmonary diseases that people might come to the coaching relationship to work on. So we're going to talk about asthma, COPD, and sleep apnea in this PowerPoint. And so asthma, a basic understanding, is a chronic lung disease. It inflames and narrows the airways. And what people will often experience is wheezing, chest tightness, shortness of breath, and coughing. And it can be controlled through self-management, and really asthma requires a strong healthcare team and medication. I think it's important to note that it's very prevalent. More than 25 million people have asthma, and 7 million of those are children. And basically this is just a quick look at what causes asthma, and that is the bronchial tubes tighten, which makes mucus get stuck, which causes everything, the air just can't move through like it normally should. So that's a quick brief overview of what asthma looks like for a person. With asthma, one of the important things to identify are triggers. So common ones are like allergens, respiratory infections, chemicals, or irritants like temperature changes, odors, stress and exercise, or tobacco, environment and food, and exertion of any kind. It can be exercise or other exertion. And here's another look at the more common asthma triggers. With asthma, we talk about having an action plan, and that really means on a green zone day, everything's going well. So what do I need to do to maintain feeling really well? On a yellow zone day, I'm starting to get symptoms and they're not resolving. And so what is it I need to do to relieve? And usually people have a quick relief or what's called a rescue medication, whether that's an inhaler or nebulizer that they use in those situations. And then there's red zone, which means things are really not going well, and sometimes the rescue medication is not helping. So if that does not improve, obviously then they need to go to an emergency room and get medical help. So with asthma, it's really important to have an action plan in place. And self-management is really, again, stress reduction, taking medication, and measuring using what's called a peak flow meter. It's a way to check how much air is flowing through the lungs. And then having supplies in multiple locations. With asthma, people will want to have inhalers in more than one place, so that may come to your attention as a coach. And knowing when to seek medical help. Obviously you're going to hear this for every clinical condition. It's just so critical. But stress reduction is one of the best ways to help manage asthma. And here's just a quick look if you want to know what the different inhalers are and what they do. But inhalers really deliver a puff of medication, so that's how they work. And then there's the nebulizer, which is a stream of medicated air, and that's used for when more symptoms are present. So people usually use an inhaler first and a nebulizer if their symptoms increase. And we just want you to know that in the back of your mind in case they ask for some help with their rescue or with their action plan for their condition. So when to get medical attention with asthma, it can be life-threatening. So knowing that if they're having trouble walking or talking, they're probably not talking to you in the first place. But if they're hunching over or their lips or fingertips are blue and they're breathing very slowly, they need to get to an emergency room right away. The second condition is chronic obstructive pulmonary disease, and that really encompasses two main chronic lung conditions. And the leading cause, let me back up. And those two conditions limit the exchange of oxygen and cause inflammation of the airways. And cigarette smoking is the most common cause, but the other cause is long-term exposure to lung irritants. So people who've worked in a factory all their life may be at risk. Here's just a quick look at what smoking does to healthy lungs over time. And emphysema is one of the conditions that falls under COPD. And the effects of COPD are mild, moderate, or severe depending. But it's shortness of breath, coughing with large amounts of mucus, chest tightness, wheezing, and decreased ability to do activities of daily life. And the things a person can do is quit smoking, avoid those irritants, take medications as prescribed, follow a healthy eating plan, and people with COPD often find that eating smaller meals are easier to digest because as their breathing changes, it may be harder to digest. And then also, much like an asthmatic, they need to have a rescue plan for when symptoms get worse. So managing COPD, bronchodilators to relax the muscles around the airways, steroids to help with airway inflammation. They usually get vaccines very routinely. There is pulmonary rehabilitation for their lungs if they need to build them up, oxygen therapy, surgery, and lung transplant. So those are some common ways they manage. And this is just to look at building that support plan. You know, what's the maintenance plan? What's the rescue plan? What are the medications? Doctor contact numbers, nearest emergency care facility. And I think the key thing that's bolded is make sure they have a support person who knows all of these things in detail, because if they're in trouble, they're not going to be able to make a phone call and get themselves help. Then we're going to spend just a minute talking about sleep apnea, because it can be a serious and it is a common disorder. But it's when the breathing stops or gets very shallow when the person is sleeping. And it happens several times in an hour. So a person may be sleeping in bed but wake up really tired because they're not getting quality sleep. It's more frequent in men than women. And the way it's diagnosed is with a physical exam and interview, and then a sleep study is done to confirm that. Here are some of the effects of sleep apnea. I'll let you just take a look here. But you can see that some of them are pretty severe, pretty significant, including creating comorbidities like diabetes and heart disease. So risk factors are age, being overweight, having a really thick neck size, being male, having high blood pressure, smoking, having allergies, using a lot of alcohol or sedatives, and enlarged tonsils. So self-management is usually losing weight, quitting smoking, avoiding alcohol, sleeping pills, and sedatives, avoiding caffeine and heavy meals, especially before bedtime, and maintaining regular sleep hours. And we wanted to quickly differentiate between what a smoking cessation specialist will do and what a health coach might do to support what the smoking cessation specialist will do. So just know that the smoking cessation specialist will cover these key things, which is the creation of a quit plan. When is the person going to quit? How are they going to quit? Who's going to support them, etc. So they'll go into great detail of all of that. They'll help them with getting nicotine replacement options if that's what they need. They will help them with ways to manage triggers, cravings, and stress. And they will help them with the side effects of smoking cessation, like irritability, weight gain, and changes in their social circles. So they really do a great job of really helping that person look at their whole life and put a plan in place for how they're going to stop smoking and what's going to need to change in their life to make that happen. How other coaching can support that is really stress management. Again, obviously is huge because people's triggers are going to arise and they're going to need new coping skills, so stress management is critical. Also weight loss. People who smoke often gain weight as a result of quitting smoking. Creating new habits for when triggers arise and creating new coping skills. Obviously their tobacco cessation specialist will help with that, but I think coaching ongoing will need to help address some of those. Creating supportive relationships and social lives that don't center around smoking. Often smokers hang out with, at work and other places, other smokers, so they're going to have to change everything about their life. And then relapse. Most smokers will attempt 8 to 10 times before they successfully stop smoking, so it's good to know that as a coach you can support them in making those additional, getting back in touch with the cessation specialist and making those additional attempts. And here's a quick look at Dr. Weil's Pulmonary Disease Guide. He has some supplements that he finds helpful and some dietary recommendations to help with the management of pulmonary disease, as well as a breathing exercise. And for smoking cessation, these are the most highly researched and most common integrative approaches that have been found to be helpful, and those are acupuncture, guided imagery, hypnosis, and mindfulness-based stress reduction and other stress reduction techniques. So just know those are the key ones that are used. And here are tons of resources, and again, you'll have all of this available to you.